My name is Corinne Feldman. I'm a physician assistant. I'm the Director of Didactic Education at the University of Southern California's Primary Care PA program. I'm also an assistant professor of clinical family medicine at USC, and I've been in PA education since 2011. One of the real honors and privileges at USC that I'm able to participate in is rethinking how we teach health equity and diversity and inclusion in the PA program curriculum and where that fits in higher medical education. The reality is we do a really good job in healthcare of taking care of the people who are right in front of us, who fit certain parameters that we as the providers are comfortable with. And the reality is there's a whole group of people, they're not even a group, there's thousands of people who are not in our waiting rooms, who are sort of forgotten or invisible to us as healthcare providers. And one of the things that I think I will always hold true to is that if you want to change how medicine is provided, you have to change how it's taught. Because we learn really early on when we're forming this identity as a new clinician, what it means to value someone else and what is valuable to our healthcare system. And so this curricular shift, if you will, is really taking a hard look at how do we teach everything from how do we take a history to how do we create a plan that actually is rooted in reality for the person that we're treating, not rooted in the textbook that we gave the students, and really challenging them to change their perspective about people that they may know nothing about. And how do you do that in a responsible and humble way so that both parties get what they need and desire out of each healthcare encounter? I think there's two projects that really highlight how we're trying to elevate higher education curriculum around this idea of social determinants of health, which is very popular and required for all of us that are in PA education. The first is called Trojan Trainer, and that is a program that takes one of our unsheltered street medicine patients living in Los Angeles and pairs them with a team of PA students and medical students that will stick together for a year. And the goal of that program is actually for the unsheltered individual who has the lived expertise regarding social determinants of health to actually be the trainer, to train the PA and MD students about what it's like to live in those intersections of social determinants of health. So they work together on problem solving hard problems that the Trojan Trainer is bumping up against, but the students bring really important, valuable things too, like cell phone minutes and internet access and companionship to doctor's appointments and things like that. And so that's a really empowering process, both for the Trojan Trainer as well as for the students to figure out how to problem solve and stick with hard problems without kind of moving on to the easier patient, if you will. The second thing is really focusing on how do we think about community social determinants of health and resilience building. And we do that through a documentary making process. We challenge the students to choose a county in Los Angeles, there's 88 of them to choose from, and create a documentary that asks the question, what does wellness and resilience look like in those communities? And what we hear over and over again from the students is that what they Google, which is usually a list of deficits that describe a city from a public health standpoint, is not matched by the joy and pride that the people who actually live in those cities experience. And so we love that challenge of what you thought you knew and then the reality that's right in front of you in both of these programs, and how do you reconcile those differences? And I think that provides meaningful kind of higher level thinking that belongs in PA programs.